பண்ண மாதிரி ஏதோ சரி.
And all our colleagues were gathered here today. 25 years ago, diagnosis of cancer, so many years, the latest techniques are available, the latest screening techniques are available, and a very small lesion can be diagnosed very, very early. And it is the right time to actually stress at the launch of a HIPEC Center, which is a way we're talking about. It gives me immense pleasure on behalf of Gleneagles Global Health City to welcome all of you and kickstart the proceedings on the launch of this center. May this also spread the message of getting early diagnosis and screening of cancer among all of us. Thank you very much.
To overcome COVID. I mean, very energetic, very fantastic man. Second time sharing the stage with him, and I'm still happy that he agreed to launch this program and then come. So I'll briefly talk about what is HIPEC, what do we do in cytoreductive surgery in HIPEC. So surgery is a common treatment for many abdominal cancers, but sometimes surgery alone cannot treat all cancers. So early disease, yes, but in advanced disease, what we call as peritoneal carcinomatosis or peritoneal surface malignancies, you need something more. So a specialized complex procedure called cytoreductive surgery, that's extensive surgery in the abdomen with hypothermic, that is heated format of intraperitoneal chemotherapeutic agent given the specialized dedicated machine which runs for 1 hour, 1.5 hours inside the abdominal cavity, cures most of the cancers, and I'll tell you what are the cancers that we deal with. So this is the specialized machine that we use, a HIPEC machine. So where all it is being used, which are cancers it's being used is ovarian cancer, that is recurrent ovarian cancer. Most of the time the ovarian cancer have a tendency to recur after your initial treatment. So recurrent ovarian cancers and sometimes primary ovarian cancers, they are large. And if the stage is third stage, we give HIPEC treatment. And appendicular cancers is a very unique cancer called pseudomyxoma peritonei or appendicular neoplasm, where the cytoreductive surgery in HIPEC is the only best treatment available as of now to cure patients. And colorectal cancers, colonic cancer, rectal cancer, when they are spread to the peritoneal cavity, not spread anywhere else in the body, this is one of the best treatment available. Gastric cancer, that's stomach cancer, and primary peritoneal cancer where you don't find the primary but the entire peritoneum is involved, and malignant peritoneal mesothelioma is a very, very rare condition. So these are all the conditions where this treatment is being offered and being used. So the patient selection criteria, the performance status of the patient has to be good, and because we have various scores, VCOG 1 or 2, and the patients having low disease burden. I mean, it's not an academic forum survey, I don't want to get into the details of the PCA index, all that. But usually the volume of disease is rate from 0 to 30. These patients do better with this form of treatment. So surgery, what we do is we do surgery for 6 to 8 hours to resect all the tumors within the abdominal cavity, and all the visible tumors are removed. Sometimes we may resect some of the organs like stomach, rectum, appendix, gallbladder, of course, uterus, ovaries. And after you completely resected it, then you go for a hypothermic intraperitoneal chemotherapy with a specialized dedicated machine. So what is the advantage of this intraperitoneal chemotherapy? That's the chemotherapy given inside the abdomen during surgery is it delivers high dose of chemotherapy directly to the cancer cells, and the high penetration of chemotherapeutic agent because the dose given is more than compared to given in intravenous, and single dose therapy and very fewer side effects, and single sitting surgical removal of disease with chemotherapy, and significantly increase the survival of advanced abdominal cancer patients. I tell you the survival is all these patients otherwise don't get scared. If you are not treated with this, they will not live for more than 1 year or maximum 1.5 years with further treatment. But with this CRS HIPEC which we have been doing, most of the patients live for more than 5 years. So the 50% of them live for more than 5 years, and rest of them may live for 3 years, 5 years, or more than that. So definitely it has added to the surgical armamentarium of cancer surgery and oncology treatment. This is one of the videos where you see the disease. The disease is so much. All the dots are disease, all the white sticks are disease. It will be all over the abdomen. But it will be scary to look at. Any previously 10 years back, 15 years back, even in now today, some of the centers, they will close the abdomen and come out. But here we know that we are going to deal with this kind of disease. So we already know that the disease is going to be like this. And we do the surgery, at the end of it, the abdomen looks so clean like this. We have resected the organ, the right colon, and we have done the anastomosis of the small bowel to the transverse colon. And the entire disease is removed now, it is very clean. There is no disease left out. So all the peritoneal layers are removed. Peritoneal layers are nothing but the paint of the wall. So if you remove the entire painted layer of the wall, and after this, the abdomen is lifted up, and then the inner tube is made. There is one inner tube and one outer tube, where through the inner tube the medicine goes in, the outer tube the medicine comes out. It gets circulated in the machine, dedicated HIPEC machine. And we call it semi-open technique. We put an oxide plastic kind of cover to close it to maintain the temperature. It's a kind of Indian way of doing it to reduce the cost. So this much of tumor is removed and hyperthermic chemotherapy is given, and most of the patients do well. And all over the world, the average hospital stays around 22 days. But in our setup, we have been doing for the last 10 years, and the average hospital stay is only 12 days. And we have not lost any patient in the immediate post-operative period. This is the survival benefits. As I told you, otherwise these patients will live for only 12 months. So they all live for more than 5 years now. So we have been encouraged by the patient's results, and we have been doing more and more HIPEC treatment, and we are launching it after finishing more than 100 cases. So normally people launch it and then start doing it. Here, because it's kind of initially experimental therapy, we wanted to make sure that the survival is good, and then we are launching it after 5 years actually. This is the experience with pseudomyxoma peritonei and ovary and colorectal cancers and various rare indications. So most of them, the results are pretty good. And we select the patients very carefully, and proper patient selection and counseling. And this multidisciplinary approach, we have a surgical team. I plan my surgical team because the entire surgery goes on for 10 hours. So we start at 8 o'clock and finish at 8 o'clock. So the entire surgical team is geared up, and surgical team includes my surgeons, anesthesia team, intensive care team, my staffs, OT technicians, everyone involved in this. Everyone are dedicated, and medical oncology team is led by Dr. Ramprabhu, and radiology, pathology, anesthesiology, paramedical staff, everyone is involved. And for next 5-6 days, everybody is geared up. So it is not that one-time event and then not gallbladder surgery or appendicitis surgery where we can leave the patient and go. So I really thank the entire team and the global team for the dedicated post-operative care and pre-operative nutrition. So this is the intraoperative picture. This is my team. It's only half of the team. There are lot more people involved in this. The dedicated HIPEC machine. And there's an animated video. I'll just show you a small animated video so that people will understand what is HIPEC therapy is.
Hyperthermic intraperitoneal chemotherapy, abdominal cavity, or peritoneum. Doctors begin with what is called cytoreductive surgery to remove all visible tumors in the abdominal area. The extent of the surgery depends on the findings during surgery. Surgery can involve the removal of tumors in the upper and lower abdominal area, on the omentum, on the liver, stomach, small intestine, colon, rectum, pancreas, spleen, appendix, uterus, ovaries, and the peritoneal surfaces. Surgery to remove tumors is thorough and aggressive, with the goal of preserving organs whenever possible. The doctor carefully examines the abdominal region, quadrant by quadrant, searching for and removing tumors. With great care, the doctor uses highly specialized surgical techniques to strip the tumors from the peritoneal surfaces and organs and seal small blood vessels. All of the visible tumors are removed. Next, the doctor administers the HIPAC, or heated chemotherapy treatment, with the goal of killing any remaining cancer cells that cannot be seen. Tubes and temperature probes are placed into the abdominal cavity. The doctor briefly closes the skin of the abdomen with sutures. The abdominal cavity is flooded with a solution that includes chemotherapy drugs. This solution is heated. The tubes and probes are connected to a machine. This controls the temperature and flow of the solution. The heated chemotherapy solution is continuously circulated throughout the abdominal cavity so that the cavity is uniformly exposed to heat and chemotherapy. The combination of heat and chemotherapy causes the solution to kill microscopic cancer cells. Gentle shaking is applied to the abdomen to help the solution distribute to all surfaces within the abdomen. Following the HIPAC treatment, the fluid is drained from the abdominal cavity. The abdomen is reopened and the tubes and probes are removed. At this time, any necessary reconstructive surgery is performed. For example, the doctor may need to reconnect a resected colon. Finally, the doctor closes the abdominal incision. The surgery and HIPAC treatment together may take 6 to 12 hours to complete.
This actually, and we have started doing robotic surgery in the last 4-5 months. We have completed almost 60 cases. And we have done one of the CRS HIPAC with robotic without opening the abdomen. That may be the first patient, is an 80 years old lady with cancer of the ovary. And maybe first of its kind. We don't know whether they have done anywhere else in the world, but we want to document it, want to see the survival of the patient, and probably will document it a little later. Once again, thank you, Mr. Radhakrishnan, for coming over here and inaugurating, and thank everyone in the auditorium for patient listening. Thank you.
Years of age பார்க்கும்போது எனக்கு வந்து என்னோட வயிறு வந்து பெருசாகிட்டே போச்சு. ஆக்சுவலாக I thought I was like putting on weight. சரி ரொம்ப பெருசாகுது அப்படின்னு I just thought about it. And எனக்கு வேற எந்த சிம்டம்ஸுமே இல்லைங்க. Actually, I didn't have any other symptoms, so I was working with an IT firm in OMR, and I was going for gym, working out, ella pannittu irundhen. So I never thought it's going to be this big disease. So at one point I had a little bit of stomach ache irundhudu solittu enoda gynecologist poi na check பண்ணும்போது அவங்க ஐடென்டிஃபை பண்ணிட்டு அவங்க சொன்னாங்க like Perambakam. I didn't know about this hospital, I didn't know anybody here. And அவங்க டைரக்ட் பண்ணனால நான் இந்த ஹாஸ்பிட்டலுக்கு வந்தேன். அண்ட் இங்கே வந்த அப்புறம் I didn't know anybody other than Dr. Rajasundaram and his team of doctors. And from then on, they became my superheroes, I should say, especially Dr. Raja Sundaram and Mr. Dr. Ram Prabhu and their team like Dr. Madhurima and Dr. Vimala Adityan, Uma Shankar, who were then my superheroes and forever will be my superheroes in Asulra. Every day they used to come, they used to tell the procedures. Even once they diagnosed, Dr. Raja Sundaram and Ram Prabhu gave so much of courage to me. And avlo தைரியம் சொல்லி எனக்கு சொன்னாங்க இந்த மாதிரி you have gone through so much, like your disease has spread up so much, but you need not worry about it, நாங்க பார்த்துக்கிறோம், நீங்க வந்து கவலைப்படாதீங்க அப்படின்னு சொன்னாங்க. But as usual நமக்கு எதுவுமே தெரியாது. So I was like, the entire family, my husband, my daughter, my sister, my mom, everybody were like totally traumatized. ரொம்ப பயந்து போயிருந்தோம் என்ன நடக்க போகுது அப்படின்னு தெரியாம. So I would say it's like completely God's grace that my gynecologist routed me to doctors Raja Sundaram and Ram Prabhu. ஏன்னா அவங்க தான் இன்னைக்கு இந்த வீடியோல நீங்க பார்த்த complete video is like was performed on me. Like the entire animated video, you could take me as an example because the entire HIPEC surgery was suggested by Dr. Raja Sundaram to my husband, and I was like totally lost illingla. And my husband told illa doctors nama complete nammuvom and they will do their best and solrang. So we completely trusted the doctors, and here I am totally all right now. And throughout my treatment, throughout my treatment, the entire team of doctors is so supportive. And ஒரு தடவையும் எனக்கு வந்து டாக்டர்ஸ் வந்து நீங்க ஸ்பிரிச்சுவாலிட்டியில யோசிங்க, டைவர்ட் பண்ணுங்க மைண்ட் அப்படின்னு நிறைய. நான் வந்து ராம் பிரபு சார் எல்லாம் கேள்வி கேட்கறதுக்கு அளவே இல்லை. The amount of questions I've tortured them with like too much. Every day I'll get so many questions in my mind. நான் இதுக்கப்புறம் எப்படி இருக்க போறேன், my daughter was in 9th standard, நான் எப்படி நான் வந்து ஃபேமிலியை பார்த்துக்க போறேன், what will happen அப்படின்ற questions இருந்தது. But now like my daughter is into college, அதை நான் இன்னைக்கு பார்க்குறேன்னா it's purely because of them. And என்னுடைய ஃபேமிலிக்கு immense support சொல்றோம் because எங்க அம்மா she was aged and my sister அவங்க ஃபேமிலி விட்டுட்டு my husband அவங்க எல்லாம் வரும்போதும் they used to tell them words of courage, like நீங்க பயப்படாதீங்க, we perform the best surgery called HIPEC, so அவங்க கம்ப்ளீட்டா நல்லா ஆயிடுவாங்க அப்படின்னு சொன்னாங்க. So we were like blindly trusting the doctors, and by God's grace I was rooted to the right hospital, right doctors. So and அதனால I'm like totally all right now. Slowly it's like 3 years now, and I'm like looking completely normal, like a normal person. Many of my family and friends don't even know that I got a disease called cancer. Though I was like diagnosed almost closer to the last stage, I'm like perfectly all right now, and I would like to give this courage to every one of the people sitting here, and my friends, family, everyone. Like if we are at the right place at the right time, we can definitely get out of this disease. And நாளைக்கு யோகா போங்க, எக்ஸசைஸ் பண்ணுங்க டாக்டர்ஸ் சொன்னாங்க. ஸோ அதை பேஸ் பண்ணி இன்னைக்கு நான் அதெல்லாம் பண்ணி இந்த லாஸ்ட் 2 months பேக் நான் ஹிமாலயாஸ் போயிட்டு வந்தேன். ஹிமாலயாஸ் போயிட்டு that was one of my bucket list, and so நான் அங்கே போயிட்டு வந்ததுக்கு I was really praying for them because அவங்களால தான் இன்னைக்கு I'm surviving, doctors and my family. So thank you so much doctors for making me get through all this. And anybody, I would say please don't panic, யாரும் பயப்படாதீங்க. We have the right medical treatments today. So நம்ம right placeல வந்துட்டோம் அப்படின்னா the doctors will definitely take care of us. I was blessed to be at their care. So I'm like thankful to them. Thank you so much doctors. Thank you for the opportunity.
Thanks, Dr. Raja Sundaram, for inviting me to just share my wife's experience over here. Respected sir, Dr. J. Radhakrishnan, Dr. Raja Sundaram, and other doctors and his team, wonderful team. My wife, initially in 2015, she had a cancer of uterus. It was rightly diagnosed immediately without any delay. And we went to we were recommended to the right doctor at the time. Immediately the treatment was started, and the surgery was performed in September 2015. After 2 years in 2017, again there was a recurrent disease. Sir has recommended that we have to perform this type of surgery in 2017. October 2017 it was decided, and November 2017 The surgery was performed, which lasted for 8 hours from morning to evening. And she was, wife was discharged 9th day she was discharged from here. 3rd day so she started walking. It's all because of the doctor's treatment, and the other team of doctors also took care of my wife daily, morning and evening. Anytime they'll be coming, they gave so wonderful, heart-touching words which made my wife to come out of the fear. Of course, once we have the fear psychologically, we can come out. So fear, first we have to take out the fear in our mind. So that itself will be a great help, and it will help the patient to come out of this disease. And now it was performed in 2017, and now almost 5 years is over, and now she's in 6th year. Absolutely, there is no problem at all. Only thing, every quarterly we meet doctor as per his advice, and every year she undergoes PET CT, everything. Absolutely, the result, everything is nil. She's absolutely fine now. Of course, now she's not in Chennai. She has been relocated to Mysore because of the temperature, because she's not able to bear the heat of Chennai. So that's one of the main reasons she relocated to Mysore, which is her native place. Absolutely, she's doing fine. Of course, every quarter we come and meet doctors and go as per his advice. Last but not least, it is God's grace. She's surviving, and the doctors, Dr. Rajasundram, really we must be very thankful to doctor and his team, everyone, the sisters who helped the patient, everything. In fact, doctor used to recommend other patients to get the feedback from my wife so that she can share her experience. That itself will give a boost for them, not to have any fear. So my wife is absolutely fine. She's doing well. She is taking care of all her work. Nothing is, she's not depending on anything. And she's fine. Nothing to say. So I thank once again Dr. Rajasundram and his team for the wonderful support and taking care of us. Thank you all.
I have no symptom regarding cancer. I'm a civil engineer. I'm working in Dhaka with Apple. Then, when it was detected, then my daughter, she is very much familiar with Rajasundram sir and other all doctors, technologists, nurse. And I expressed my gratitude to my doctor, Rajasundram sir and Ram Prabhu sir. Actually here, their behavior, cooperation, inspiration is too high. Actually, I checked with Thailand and Singapore for this treatment, but my daughter connected with Rajasundram sir. At the time, I was not very good condition. Then here, came here and take treatment, and everybody very much cooperated. But I don't feel I'm staying outside the country. But all are very good cooperative, very good and cooperative, and treatment plan is very smooth. But surgical time I staying in hospital 17 days. Then every time Rajasundram sir came here, Madhuri and Anuradha, another doctor, I always remember. Venkatesh, actually here 3 times I came here. But the treatment, I express all good expression to my pain, my society. Then actually it is not any fear. The doctor of India is to hire the treatment process and other thing is very good towards the patient. Especially inspiration of Rajasundram sir is too high. And I remember all my life, and then my family also prayed when detected this cancer. Then after this treatment, 7 months treatment, it became, I think, Almighty Allah give me grace for the remaining life to Rajasundan sir and Ram Prabhu sir and other gentlemen, doctors, technologists, Risham, Dr. Risham and others. This is my good memory, and I give all my thanks to all. Thank you, everyone.
Mr. Mohammed Azami, Ms. Tilagam, Ms. Tainuri, and Ms. Sarah Isaac.